When you think of corporate America and the things that happen today, it seems like the interaction with an individual person is lost. And so for RSA, really it was the idea of saying, if I can create a process that uses the art and science of medicine, and when I say art, I mean the art is people, and the science is really data and technology, but do it in a way that creates very unique interactions that gives a patient a voice.
RSA Medical is extremely unique in that we have real doctors, nurses, clinicians that are on the phone talking to patients in order that they can really activate the care that they need to get.
They come first when we're doing our medical histories. We give them the opportunity to tell us their story so that we can provide that information and so that they can become a bit more empowered in what they need to do with their health care.
And we inspire them to make the right changes or make the right decisions.
If we invest in that relationship with the patient, everything else falls into place.
We try to make an environment that is very similar to sitting in the doctor's office, except you're on the phone instead of being, across the room from a nurse or a doctor.
No different than if I was taking a medical history bedside and explaining and guiding our patient to why we need to know the information. We're able to do all of that over the phone.
We hire a variety of employees here. Our largest group is our clinical interaction specialists. We have a variety of other positions, obviously, that we're hiring for on a regular basis, from IT to administrative support. When we look and recruit people that work here at RSA, we look for people who they have a way of empathizing with people on the phone and hearing what's in the tone of their voice and the needs that they have and helping them address those needs.
Our culture really does focus on continuous improvement and trying to get the most out of every interaction that we possibly can.
Just because something's done a certain way doesn't mean it's done the best way. And there's always ways to improve.
So we're not a cookie cutter organization. We're innovative, we'll make suggestions, but it's a collaborative effort to create some of the programs that will be slightly unique for that individual client.
The opportunities are almost endless because we have every level of clinician here, and so those that are just out of school and those who have been in the practice and are ready to do something different.
In this clinical setting, I found that I could still keep my patients first, I could still keep my medical knowledge fresh, and I could keep enhancing that medical knowledge and my career at RSA Medical.